The two members of parliament, a nurse, and about 20 confirmed cases at Zambia's parliament to COVID-19. Many Zambians demanded that it adjourns, and parliament, through Vice President, will today virtually set to adjourn Sindai.
We are strongly advising the Speaker of the National Assembly to immediately suspend all parliamentary sittings until further notice.
It is shocking that the National Assembly continues to operate despite some of its staff and some of the members of Parliament positive for COVID-19.
The calls have been loud and clear, and Parliament has adjourned to save lives. Zambians called on Parliament to close following the 2 deaths of members of Parliament and a nurse from National Assembly Clinic that died from COVID-19 last week. From the about 20 confirmed cases from that precinct, the House had continued sitting, but Clerk of the National Assembly, Cecilia Mbewe, issued a notice that today's sitting will be done virtually, and the order paper on the proceedings of Parliament on a particular day shows that the virtual sitting will only be for the leader of government business in the House, who is the Vice President, who is going to adjourn Sinidai due to COVID-19 cases and deaths recorded at Parliament. Spooky Mwelebwa of Zambia DNA welcomes the decision to close Parliament.
If the Minister of Health saw it fit to advise that Parliament closes, then so that we save lives to avoid people getting infected, or those who are infecting others.
And Felix Konoso, a governance commentator, supports the move to close down Parliament for a while.
So I think it's a great thing. It's a great thing, and it's a way forward, and it will help reduce this infection. And Parliament, being one of the highest bodies in Zambia, it will give a good signal to other institutions where they will discover people positive. It will inspire them also to close down and save a lot of lives.
The country's COVID-19 cases have been on a sharp rise in the recent days, recording over 150 cases each day, and as of Monday, it passed the mark of 3,300, something that has worried the government, as Health Minister Chitalo Chilufya confirms.
That with the cold weather that we're experiencing today, we will see a surge in cases. This was anticipated. What we continue to see as also an indicator of this epidemic turning for worse is sicker patients in our facilities. Patients who are on oxygen, who continue to see a surge in cases in July, in August. But we can stop the trend. We can minimize with collective action.
Meanwhile, another mobile service provider, the government-owned Zamtel, has joined Airtel in shutting its headquarters, and some banks are shutting their branches due to cases of COVID-19 recorded. While the mobile regulator, Zambia Information Communication Technology Authority, or ZICTA, has also recorded a COVID-19 case. Now, there are calls that the country should shut down completely. But Felix Konoso, a governance commentator, says it is already too late for that action.
You cannot close a stable when the horse has bolted. We had an opportunity some time back, but now it's all over. So how do you close down all over the nation? It will be quite difficult to lock down now. All I would ask is they just should do massive testing. You see, we are having testing of 1,000, 2,000. Let's have testings of about 20,000, and people should keep their distances and wear masks. Because now to put a lockdown in this situation, the economy, people live on hand to mouth. If people live on hand to mouth, how will they survive?
Zambia has a total of 3,326 cumulative cases, 1,620 recoveries, and 1,578 active cases, with a total of 128 deaths. Arthur Davis Scopo reporting for Channel Africa in Lusaka, Zambia.
That was Arthur Davis Scopo there reporting from Lusaka in Zambia, bringing the time to 10 minutes after 1 o'clock. Virologist and Vice